Trauma is a potentially life-threatening injury to any of the body's organ systems, and time is of the essence. Anytime you have a trauma patient, it's important to get them seen and evaluated and treated as soon as possible. The EMS system, they will radio us and let us know what is happening and what injuries potentially are there, and then we will prepare ourselves with our trauma team here at the hospital.
When we get the call that a trauma is coming through, we have a short period of time to respond because it's usually just a few minutes out from our facility. So we have a list of things that we are supposed to do as each of our roles.
Can actually be a little chaotic because you have people all around the patient. You have the ER physician, multiple nurses, and they're trying to establish an IV, put on the leads, get the patient on the monitor. At the same time, you have the lab technician trying to draw the blood.
Every aspect, every step of the way has an impact on the patient. And it starts with EMS and recognition that this patient could have significant injuries. That is a cascade that filters down from EMS to the emergency room, from the emergency room to all of our ancillary departments and surgeons. And it just keeps spreading until we know that we have those resources needed to ensure the best care for that patient depending on whatever injuries they might have.
If they're not breathing, they may have to put in a breathing tube and assist the patient with breathing, or even a chest tube. If there's been a severe lung injury and they're bleeding inside, we'll put in a chest tube into the lung cavity. Or if they're bleeding and they're unstable and their blood pressure is low, we'll administer a blood transfusion or any blood products. Or we may even use the ultrasound machine, and that's when we would bring the patient directly to the operating room.
As soon as the emergency department alerts the OR that there's a potential trauma patient coming in, then we're in constant communication with them. We prepare an OR room for that patient, get everything set up for them.
From the time the patient is injured, you have basically 1 hour. It's called the golden hour, and that's the time it takes for you to correct that problem before they start spiraling down.
Trauma is the leading cause of death for ages 1 to 44 years old, nationally as well as in the state of Hawaii. Trauma does not discriminate. It could be your child running across the street to grab a ball. It could be your grandmother falling down a flight of stairs. It could be you driving home from work. It impacts us all at the most inopportune times, and it's very devastating when it does. It's been shown that trauma centers decrease morbidity and mortality, which is long-term disability and death. And so we want to ensure that that trauma system is solid.
The facilities at Wilcox are unmatched in Hawaii. The operating room facilities that we have and the equipment that we have available is ready for any trauma that may come our way.
It's a really good feeling. It's a really, really good feeling because you know that you're serving the patient, you're doing the best for them that you can, and you're helping them.
We'll be out in public and we'll have someone remember some event where we save their family member, and it's very touching. That's definitely what makes it so special about working in a community like Kauai.
And to be able to deliver that state-of-the-art care is really something that we're proud of, and we're happy to be able to deliver to the community and our own family, and so on that live here. It's something that we take great pride in, and we're very grateful we have that capability.